Laura's passion for lymphatic health comes from both professional knowledge and lived experience. After spending years managing lipedema, lymphedema, persistent swelling, and multiple surgeries, and often feeling unheard, she became determined to provide others with the understanding, treatment, and support she had struggled to find herself.
What began as a sole practitioner clinic has grown into a multidisciplinary regional service supporting people with lymphedema, lipedema, chronic oedema, post-surgical swelling, wounds, and complex health conditions all over Australia. The clinic provides specialised lymphatic therapy, medical compression garment fitting, advanced therapies, post-surgical rehabilitation, and community nursing services.
Laura is a passionate advocate, educator, and national conference speaker who is committed to increasing awareness of lipedema and the lymphatic conditions and improving access to specialised care, particularly for people living in regional communities.
Welcome back to the Lipedema podcast. We're your hosts, Shell
And Tiana, and today we have a return guest and friend of the Lipedema podcast. It is Elegance Lymphatics Care's very own Laura Hamilton. Hi Laura, how are you?
Hello, how are we all?
So good. So happy to talk to you.
Good.
So happy to hear your journey because you've had an interesting one lately.
As always, nothing ever goes to plan or as we think it should be, but it's been good. So I've just post-surgical Friday from an arm reduction and breast lift, and with Dr. Kieran Rowe, who also did my 360 back in 2021. So yeah, it's been a long road, but it's been a pretty big surgery on Friday. I ended up back having 2 surgeries. I had a hematoma develop after the first one on Friday afternoon, so I ended up back in emergency surgery at 1:00 in the morning. Till about 3:30. So it's been a bit of an interesting road, but doing a lot better now. So that's good.
Yeah, only being a week outside of surgery, that's pretty cool that you've come on to talk to us. I wanted to just, for our listeners, Laura has actually been on our podcast before, like right at the very beginning. Episode 12 is Laura's episode where we really go through Laura's origin story of understanding that she had lipedema, getting her diagnosis and her first surgeries at Walk with Freedom. And then Laura actually owns Elegance and Lymphatic Care, which is an online platform to help people get access to garments for post-surgery and also normal compression garments. And we can go through all of the other things that you do, Laura, very soon. But I just wanted I don't believe in episode 12, we talked about your 360 and what brought you to have that surgery.
Yeah. So what happened was that I actually had lost a significant amount of weight. So I had the sleeve done, and the biggest I got to was 139.6 kilos. So very big. And just recently found some photos the other day, which was mind blowing to think that even was me still. I just couldn't believe it. Don't know how I'm still here. To pick a set of scales up and throw them at the wall and smash them, it really does get to you, this lipedema stuff. And I guess finding out about that was kind of, I guess, a moment where I didn't know whether to laugh or cry, I guess, was what it come to, because I actually had a reason to the why for all the years of things going wrong. And so I had the sleeve done, I lost a significant amount of weight. I had a 360 done with Dr. Kieran Rowe as well. And hindsight, a beautiful thing, as we've said before. But I think that I really should have done it the other way around and had the lipedema surgery first and then had the 360. But, we all work things out. And that's, I guess, what my journey's been about, is helping others not to have to endure what I have been through. So I think that's something for people to consider when they're looking at that sort of stuff as well. So, but Kieran is a very good surgeon. Like, you can hardly see my 360 scar now. I had no dramas with that. He uses fantastic post-surgical compression garments requires 2 sets of them or he won't operate on you. Fantastic placement, and you can literally hardly see my scar now from where my 360 was. So yeah, hence why I have just chosen him to do my arm lift and my breast lift for this surgery. So yeah.
Yeah, so it's been like 5 years since you've seen him. And it's amazing how gnarly the scars are. And then you're saying that you can barely see them now. It's unfathomable how your body heals when you allow it to. You said that you should have probably done your lipedema surgery first before his surgery. Can you just talk a little bit about that for people who are thinking about having multiple stages of surgeries?
Yeah. So I think that it would have helped with the thigh lift situation. So obviously you have a lot of extraction. I've had like 11 litres taken out of my legs of lipedema. So, there's going to be loose skin. I don't think that anyone can guarantee that you're not going to have loose skin after having that done. Everyone want to be the biggest magician that they can be. But unfortunately, when you're older and, things like that, skin doesn't always come back. So I think that, in hindsight, like I said, I think that it would be better to have the surgery first and then go on and have had done like the 360 then, because it would have sort of pulled everything up a little bit more. And, I definitely could do with a thigh lift, but that's not going to happen because I've got too much damage to my lymphatic system on my right side. So I have to just deal with that. And, nothing's ever going to be perfect. So I've, come to terms with that now. But I definitely, for anyone else out there looking, I think that that would definitely be a really good road. And extracting as much of normal fat as you can first with like the really high protein, low lymphatic diet stuff is really good. GPL1, obviously, weight loss surgery if need be, and then go on to your lipedema surgery, because what's left is lipedema fat, and then I think that is a lot easier to get that out, and you're not having as many surgeries. You're not getting, having to pay for so many surgeries because, what's left is the lipedema fat. So I think that that's definitely a good option to do it that way for people that are looking to move forward in this lipedema journey. And, it's a long one. It's been a long road for me and a long road for a lot of people, but I do think that it definitely is worth considering is, getting rid of that excess fat. And it's hard. It's hard to do. It's really hard to do because, we go away for a weekend and I can put on 3 kilos in one weekend. You go and have a
You can do that smelling a donut, Laura.
Yep.
Yeah, it's
I know, right? It's the lipedema. I call it the carb monster, man. That's my name for it. All the nice things we just can't have.
Yeah, so I guess, what you're saying is make sure you've got your body in the best condition you have, get rid of as much lifestyle weight as you can, and then you can look at your body holistically and see what, with your surgeon, you can decide what needs to be tackled first and do it in a really strategic way.
Yeah. And make sure that you're making an educated decision, Go and chat with a few different people. Like I went and interviewed 3 plastic surgeons before I picked Kieran Rowe. And, I've got the best vibe of him. He was very down to earth, very easy to talk to, very realistic. And, he was very understanding of a lot of things. And especially because I got such a big medical history as well, all of that didn't bother him. He was happy to speak to my hematologist. He was happy to coordinate all of that. The blood clot that I ended up with when I had my 360, because I was in hospital for 2 weeks. So I had a blood clot develop after that. So, he was very onto all of those things. And this time with my surgery, this time with him, he was very onto it because of what happened last time. So he's very good with that sort of thing. And I think that finding the right person that you gel with is really important because, you want to have someone that you can listen to, that you feel like you're being heard and, has your back if you bring up something and you're not happy with it or you want to ask questions. And it's okay to ask questions too. I just want to say that just because it's, someone, I guess that it's someone, a doctor or someone else that has some sort of, status, I guess, doesn't mean that you as a person can't question them. And I think that that's what we all need to realize. We need to make our own best educated decisions and we need to, have a few different options to pull the best educated decision.
Yeah, and that self-advocacy served you well. When we were talking offline, you had another little complication and you said so very briefly, I'd like you to dig into that a little bit more. So after this most recent surgery, you had a complication that you noticed and you brought it up with your team. Talk about that.
Yeah, so I went in and obviously for surgery Friday, just gone. So I've had arm lift and breast reduction and I I guess I'm onto all that because I obviously work in the industry and, all my post-surgical care of people and I do a lot of post-surgical patients and stuff. But yeah, the nurses just kept saying to me, oh, the drains are fine, the drains are fine. And I said, no, they're not. I said, the drains might be fine. I said, but this hematoma that's developing here is not okay. Like there's something not right with there. I do clot very easily and I could tell that the garment I had on wasn't sitting right. So it was actually an AP variant. So I definitely will not be recommending those for arms anymore because I feel that they don't sit in the correct position. And I said I needed to get it off. And so that's what happened. And she said, oh, no, the drains are fine. I said, no, you need to take a photo of that and send that to the doctor, please. Because I said, I'm not happy with that. It doesn't feel right. It feels very sore. You need to get it looked at. And she sent a photo off. She's like, no, it's okay. He'll look at it in the morning. And I said, no, I want you to send it off to him now. And she did, and he come back with, I'll see you in theatre in an hour. So, it's okay to advocate for yourself. And just because someone is a medical professional doesn't mean that you can't ask questions and you can't, challenge and ask the right questions and, don't ignore people and be rude to them, but at the same time, we have to advocate for ourselves, because if that hadn't have happened, by the next morning, if we had have left that till Saturday, it would have been absolutely horrendous if we hadn't have gone onto that washed out straight away. So I think that, making sure that you advocate for yourself and, talking to different people and gathering all the information to make your own educated decisions, I think is really important in that post-surgical recovery era.
Gee, it's so fascinating how, and they could be incredible nurses and everything and very experienced, but they're not the ones feeling what you're feeling in your body. And it's so great that you had that you had that courage to speak out for yourself. I mean, of course you do. We know you personally. Of course you do. But like for your health, for your safety as well, that could have massive implications.
Absolutely. And that's the thing, is that you've got to be able to speak up. And like I said, just because someone's a doctor or a nurse or, a lymphatic therapist, or we don't have all the answers all the time. And,
they don't know you. They don't know your body. They've only got an overview of what bodies textbooks should do.
Totally.
But they don't know your body.
No.
And our bodies are very complex.
Extremely. My body needs to go to the teaching hospital for people to learn on.
Yeah.
When someone can come out of a spinal surgery and move their feet in recovery like I can, because they think I'm crazy with that. I'm like, it's not. That's what happens. I fast metabolize all the pain relief medication. And, they just think that I'm crazy when I say that until they actually see it. And then the nurse is like, oh my God, I have never seen that before. I said, I told you before I went in. You're not listening to me. And that's the problem, is that, I guess we develop over the years, all of the things we know work and don't work for us. And it's always good to try something new, and it's always good to give things a go. And I'm not saying don't ever do anything different, but we always need to ask questions and make sure that we're getting what we need from everything. So, if I hadn't have done that, by Saturday, it would have been horrendous. It would be really, really bad with, split skin probably, and God only knows what else. So at least by going straight back in and having the washout done, there was the 4 drains put back in, and, that was sort of down. So the drains actually go in, which, he puts the drains in, they're 50 centimeters almost into your, all the way into your skin, and you have one in the arm and one in the breast. So with the inflammation reduction with that surgery that I just had, I actually was getting chronic nerve pain where the drain was left because of the inflammation come down so quickly, and it was actually moving and pushing on the nerve ending. So I was very glad to get those drains out on the other day, because they weren't nice at all. But because the inflammation had come down so quickly with all the post-surgical stuff that I'd been doing, because I do neuromuscular taping and low-level cold laser, which I had in there with me, and the Hypermat, lymphatic drainage stuff. So I was doing all that on myself post-surgical. So that's why I've had such a good result with all the bruising coming out so quickly. Then obviously as that comes out, it allows you to heal quicker. So post-surgical recovery is so much better when you can incorporate all of those modalities together, not just a good surgeon. If you can incorporate all of the post-surgical, the good compression, and everyone works together, then the outcome is so much better for, the surgeon themselves with their work, the patient, and also everyone else. So I think that it really is an important part of that post-surgical stuff, is choosing the right compression and making sure that you have, the right procedures in place, and being aware before you go in and asking all the questions before you go.
Yeah.
Would you mind talking about some of those modalities that probably we're not, and our listeners might not be so familiar with? So the muscular taping, the laser, and then that hive mat. Would you mind going through those things? Yeah.
Sure. So the neuromuscular taping is a course that I've done a little while ago now with David Blow is his name. He comes over from Italy 6 months a year and teaches out here, and then goes back. He actually works with all the neuros overseas. So fantastic results with pain management and stuff with that. Unbelievable, actually. And even scoliosis and things like that, with straightening out club feet and hands. A lot of pain management with peripheral neuropathy and things like that with it as well. So really interesting. And it actually stretches the skin, not the tape. So when you think about taping someone, we've always thought about taping people up so they can't move. And that's not what it's about. It's actually taping people so they have more movement. So it actually picks up the skin, and the tape picks up the skin and fascia and causes in a lymphatic flow to continue to happen the whole time afterwards. So you look like a bit of a zebra with it all on. And I have some pretty cool colors. We've got tattoo and we've got zebra and we've got pink. And we always, a lot of my breast cancer ladies love the pink one. We always put that on them.
And you cut them to make them look like octopus. So it looks like they're like an octopus going down your leg or.
Yeah. So you can have, the octopus ones. You can have the straight ones. It just depends on what you're trying to do. The thicker the tape, the deeper the impact, and the thinner the tape, the more superficial. So like around the breast area and stuff, you would do like, 0.5 sort of width taping or centimeter maximum. And then say for the deeper skeletal type areas, like across your scalp at the back and down your neck and stuff for chronic migraine sufferers and heads and stuff like that. We tape all down the back, axillas down into here. And that, works really well across that area. So very interesting, very amazing. Had some great results with it. And would love to go back and do some more training with him. He is definitely been a game changer in my clinic and the people that I've had really great success with a lot of pain management and stuff as well. And post-surgical, like I recently did a hip replacement. Now she had all the bruising out and gone within 3 visits, and she was back to full-time work at 6 weeks after a total hip replacement.
Gracious, yeah. Wow.
So she was I got her into compression, I got her straight onto the neuromuscular taping and then the laser. So the low-level cold laser works. It's a Raincorp one, and I have a couple in the clinic, and it works on cellular repair in underneath. So it actually works from the inside out. So great for wound healing, and also great for that, development of new cellular repair, and really helps with the inflammation reduction. So fantastic, again, both post breast cancer sufferers or lift and reductions, any surgery really just brings that bruising out. It's really, and the faster you can get that out, the better, because it actually helps you to heal a lot quicker. So the Raincorp ones are very portable, which is fabulous too. They're handheld, got TGA approval and stuff on them. And so I've actually got 2. So I do 2 at the one time on people. So obviously, I'm busy. So I try to minimize fitting everything in. And so having 2 at once works really well. So you can sort of, get double the amount of treatment time through that area, which is good. And the other thing that I use in my clinic is a Hyvermat. Now, it's a deep oscillating machine. I actually do lymphatic drainage with the Hyvermat. And the same sort of lymphatic drainage technique that I would normally do, but I've actually incorporated using the Hyvermat now in that session, which is great. And I find that it works really well, moves a lot more fluid, and it just gets deeper into that tissue without hurting, because, as lippy ladies, it hurts to even look sideways at us most of the time. And especially if you've had surgery, we bruise badly at the best of times, let alone having surgery and stuff. So I think, being able to bring all of that bruising out, use those sort of 3 things have been a huge game changer in my clinic to achieve fantastic results.
Oh.
And, making sure the right compression's on, it's definitely worked really well. Like recently, I've just had a lady, she's actually 80, and I've just done a case study on her. She's probably the healthiest she's been in all her life. She's actually, now she knows she has lipedema, which, that's horrendous to have to get to 80 and not even know that. Like, how is that even possible?
Yeah.
Diabetic.
Sad.
She was on 2,000 milligrams of metformin a day, 2 fluid tablets twice a day. And she's gone and she had black narcotic flesh in and out of hospital with drips and stuff on her legs for that were over 12 months, on and off. She hasn't been back to hospital for 12 months. She now takes no metformin at all, completely stopped it. And her sugars are stable at 5.1, 5.1. And she doesn't take any fluid tablets at all. And the top of her thigh has gone from 81 centimeters down to 65.
Holy moly.
And that's just by coming for weekly lymphatic drainages, keeping it regular, maintaining that. She's got the wraps on. She has the Mobiderm leg sleeves to sleep in of a nighttime, things that are practical. And I think that's what we need to remember, with this, like we were saying about the post-surgical recovery and the modalities that I use in my clinic. We need to make sure that we look at things in a way that people are going to be able to manage them. And especially for the post-surgical stuff, there's no point in going, this is what you have to have, because this is what I stock and this is the brand I have. I can't handle that. Like, I think that is just ridiculous. We need to be able to offer people, regardless of brand or whatever it is, whatever is going to suit them the best is what I think we need to do. And I think that's, where a lot of people go wrong, is that just because it has to be this brand or this is the best protocol, well, it might well be, but it's no good if it's going to be in the corner and never get used.
Yeah, okay.
Yep. We need something that is going to be practical for everyone to use. And, and I think finding, getting to know your patients, finding out what works for them, what the best thing is for them, and, finding out what they didn't like about the other ones they didn't wear. Ask the questions. What didn't you like about that? Why was it so hard? What do we need to do to make it better? and then work through things to get something that's going to work for them. And I think, having all of that surgical stuff, for surgery, like set up before you go to surgery, don't wait till afterwards. Come in, have the treatments first, reduce the inflammation, be surgery ready so that you can have the most decrease in inflammation, because that will again help you recover a lot quicker. And then, having all the things in place, get used to wearing the compression before. You're going to be in pain after surgery, but at least if you're used to wearing compression, you don't think it's because of the compression then. You know what the compression's like.
Yeah.
So it's no good adding all of those things in. It's just too much overload for our body and we can't cope with that. So I think being prepared is the best thing that you can be.
Yeah, that's really good advice. I don't know if this is going to be helpful for our listeners because, but I'm just really curious because a lot of those modalities that you use on other patients and that you're using on yourself to recover from surgery are like things that you have to put on your own body or like use your hands to do the massage with the hive mat and stuff. Are you having, because you did breast and arms, issues with mobility, reaching in the areas that you need to put the tape on or whatever? Like, how do you navigate that?
So the tape's at the front, so obviously over that breast area. So it was okay to put that on. Very limited range of motion. I just had to get my husband to tie up my hair so that I could come and talk to you ladies because I can't reach my hands up. So he's done okay, but it's definitely a big thing. So I actually had the physio come in and you are able to do that. So that's another FYI for people that are in the hospitals. There's no reason you can't request the physio if they're lymphatic trained to come in and do some lymphatic drainage on you post-surgical. Because while you're an inpatient in a hospital, you don't need to pay for that. That comes under your health fund. So
such a good tip.
Yeah. So that's, I think, something that, again, and if the doctors don't know about that or not pushing that, then you don't know about it. And these are all things that are really beneficial to ask those questions beforehand. So I had Kimberly from Ramsay Health come in to Greenslopes and she did the half an hour drain on me. She hadn't actually used the hive mat, so I got it out and let her use it on me. And she loves it. So I'm going to have more of a chat with her about that. And she couldn't believe the difference in it either. She said, obviously it reduces our treatment times and things like that because of the amount of fluid that it moves a lot quicker. So it was nice. And you can actually have, there's actually a wand that I can attach to it. So I can do the wand on the front myself and things. But normally I would use the hive mat and it works on a closed circuit. So it's attached to you and then the patient holds onto the metal piece and it works on a closed circuit and then it just works through your hands. So I like the gloves the best because I'm such a hands-on person. Obviously, I like lymphatic drainage because that's what I do and I really enjoy that. And I find it a lot easier to use than the wands. So it definitely hasn't been as nice to use on with the wands, but it's definitely been okay. So, and again, my husband's been a very good learner. So I've had him on the go as well. So
he'll start like showing up in your clinic doing other people because he's so used to just
with what he's seen over all these surgeries and years and everything I've been through since, 2018, I think that photo was that I sent to you guys. I don't know, it's definitely been when they say for better or worse when you get married. Absolutely. Like it's been a really big journey. And I think that that's important too, to acknowledge the people in our lives that have been there through the thick and thin of it all. So, the ones that pick us up off the floor when we're crying and, when I throw a set of scales at the wall and smash them and, he's like, off to the doctor we go because that's not okay. So I think that, it's definitely good to have all of that care team. They don't have to be medical professionals. We can have our friends. We can have people in our lives that support us no matter what. And I think finding those people to connect with is really important because it gives us a bit of hope at the end of the day. And it also gives us a bit of clarity and people that we can draw on when things get bad, ring up and go, hey, I'm having a really crap day. I just need to talk to someone. And,
people that you can open up to, people that you can be vulnerable in front of, and there's no judgment, there's no anything. That's the tricky.
Yeah, I think that's the thing. Part. Yeah, as a therapist, and I think that's why I'm so busy in my clinic because I couldn't care less if people turn up in their pajamas. It would not worry me in the least. And, I think that, I guess, being non-judgmental towards people and not having to put on a big front and things like that, it is what it is, at the end of the day. And if someone comes in and they're having a bad day, well, then that's okay. They don't want to talk at all or they do want to talk, then I think you just have to learn to go with that. And I think that that's something that really does need to be taken in consideration, through a lot of therapists as well, making sure that people feel comfortable in their environment that they're in.
Yeah, for sure. Look, we probably should have covered this earlier on the episode, but can you just talk about your clinic, where it is, how people can access you? And then we can go on with talking about other stuff. But I just feel like you've been talking about your services, but we haven't actually set those, parameters.
Okay, so I'm located in Mackay in Queensland. I have 3 treatment rooms, reception area set up, and I also got some very exciting news expanding into a second clinic at a doctor's surgery as well.
Wow. Oh, congratulations.
Yeah, so which is pretty cool. So I've got 2 nurses who work for me now, and I've got a couple of admin staff and myself. So gone from just myself to getting bigger by the day.
A team.
So, yeah, definitely. I think that it's really good. So I'm going to sort of move into like some community nursing stuff as well, compression garments for post-vascular surgery, things like that. So, and I have an online platform as well. So I sell compression all over Australia. We do send some to New Zealand as well. So when I was first starting out, it was really hard to get compression garments, really hard. And to get something that was practical, and also living in North Queensland, something that's going to be doable in ridiculous weather. So we have the online platform as well, so you can buy all compression garments and things like that off us. I do offer a consult service as well, which I really want to talk about a little bit. And I only charge like sort of $130. I don't even charge my full rate for it. It's just about helping the fellow lippy ladies to select garments that they're actually going to use. Because, people don't want to spend money on having a consult, but at the same time, you're better off to spend the money on the first time. Get all your measurements, have a Zoom call. I can see where you're measuring. I can have a look at your body. I can see what's going to fit, what's going to go where, and then suggest a few things that might be practical for you to be able to get. And you don't have to buy it all at once. You can just make a wish list, and, birthdays, Mother's Days, Christmases, you can add to the wish list. And I think that that's really important. So being able to do that and have that online platform as well to be able to do the consults all over Australia is really beneficial, because I think, negotiating that lipedema surgery, who do I choose? Where do I go? What do I do? What compression? We should have to do this. We have to have class 2 this, so we have to do that. At the end of the day, we have to do a lot of things in life. But if you can't manage those things, then, something is better than nothing. But having something that fits correctly is also really important, because otherwise you're just wearing leg warmers.
Totally.
What's the point in wearing them? So, so that's something that we offer. Like, I've got the admin lady in the clinic as well. So she's great at answering all those emails and stuff. And I usually schedule those telehealth appointments in after hours, because most days I'm in my clinic from 7:30 in the morning till 6 at night. Between 8 and 11 patients a day at the moment. And so extremely busy. And then, like I said, expanding into the doctor's surgery as well. So, we're sort of going to be having a room in there, and the nurse will be based out of there. So community nursing hub sort of thing. We'll be able to do a lot of post-surgical wounds, and with the laser, because laser's fantastic for that. So that's sort of where we're at, and where we're located, but we do service the whole of Australia. So with those.
So that's still in Mackay, both locations?
Yes. Yeah, both in Mackay. Yeah.
Yeah, I think that online telehealth consult for choosing the right compression or something that you'll be able to wear is so needed. It's so overwhelming to know that you have to wear compression. You really know you have to wear them every day. And so you have to commit to something that feels comfortable, and nobody knows where to start.
No. And that's the thing. I think going through all of that, we spend enough money on this condition as it is. It costs us a fortune to live. The MLDs and all those sort of things. And I think getting the most bang for your buck is probably the right words to use, because, we can't afford everything. And, life's expensive as it is, let alone trying to navigate $800 pair of compression garments. If you can get into an off-the-shelf sizing, yes, it might not be the best protocol, but at the end of the day, it's something that's doable. You can buy 3 pairs and you can then swap them in and out. And you're going to, some compliance or regular compliance is going to be a lot better than having something that's 4 inches thick that you can't actually wear, and the likes of the wraps and things like that. There's a lot of options out there. And I guess I've worked out a lot of the options and gone through everything, because I have to wear compression 24/7. So there's not much I haven't tried over the years, and worked out what's good to wear and what's not to wear, and what works the best too, and what's going to get the best reduction and things like that lady, 81 centimeters down to 65. And we just did the reduction with that. And then she just wears the Mobiderms of a nighttime. They're quite comfortable to sleep in, all of those things, just the little things I think that sometimes get overlooked. And by having that chat, I say to people, write a list of questions. You got me for an hour. Nothing's off the table. Whatever you want to ask, get the measurements out of the way first. Have a look at you via the Zoom. Have your support person there to measure you, and then just write a big list of questions. Anything you want to ask is what I usually offer in those appointments, because I think it sets people up for a good start with this lipedema journey. I think that's what people need, because everyone gets on Facebook and they get down this rabbit warren and lost with all these suggestions and, all that sort of stuff. And everyone wants an easy fix and everyone wants something that's going to work. But, we all would love that. I'd love to have a magic wand in my clinic. It'd be great.
Yeah.
But it doesn't
We'll
work
line
like
up
that.
too.
Yeah, it doesn't work like that, mate, unfortunately. I wish that it did, but it doesn't. And, sometimes we just have to do things that we don't love, but it's got to be better. Some things are better than others that we don't love,
For sure.
Yeah.
Yeah, for sure.
Yeah.
Love that.
Oh, thank you, Laura. You are doing an amazing job, supporting us, the community, and a week out, coming up and chatting to us.
I know.
Legend.
Well, we wish you all the speedy recovery, but you're doing all the right things, so you're going to have amazing results.
Yeah, let's hope so. Hey, I think it's looking pretty good so far, so we're getting there.
Awesome. Well, you know how to look after yourself, so you're in good hands.
Yeah. I'll see you at the catch up. Because I'm down here. I'm going to pop out to your Lipedema catch up. So try and get there on the 1st.
There.
Yeah, so it'll be great to actually catch up with you guys in person and see everyone there. So if anyone's coming that day and wants to have a chat, then more than happy to do that. So
yay, love that.
Good. We will see you there. Thank you so much for joining us, Laura.
Okay, no worries. See ya. Bye.
Bye. We've created downloadable trackers for conservative management and supplements, plus some gorgeous Lipedema podcast merch, all designed to support your well-being and celebrate our community.
When you shop through our store, you're also helping us keep the podcast growing and thriving. Explore the range at lipedemapodcast.com.au.
Lipedema and its symptoms vary from individual to individual. The opinions and advice voiced in this podcast are of a personal nature and used for educational purposes.
Please take away from this podcast what resonates with you, and please see your GP or preferred specialist for diagnosis and healthcare. We are Shelley and Tiana from the Lipedema podcast. Until our next episode, bye for now.